Dr. Eric here to talk to you about premature ejaculation. I'm going to explain what premature ejaculation is and discuss some of the ways to help with this problem. So, what do you think premature ejaculation is? Orgasm before penetration? Orgasm within 30 seconds, 2 minutes, 5 minutes? It's actually all of those and none of those. Premature ejaculation, or PE, is when ejaculation occurs sooner than the man or his partner would like during sex. What this means is that it's different for every man. If a guy has an orgasm after 30 seconds and is happy with the sexual experience, then it's not premature ejaculation. If sex lasts 30 minutes for another guy, but he wanted it to be 45, that can be premature ejaculation. In the United States, about 1 out of every 3 men experience premature ejaculation, so this is a common issue. When it happens occasionally, it's called rapid ejaculation. While it can certainly be frustrating, it's usually not a cause for concern. This is unless it happens often and causes problems with relationships or sexual enjoyment. Let's talk first about how ejaculation works. There are 2 phases to ejaculation: emission and expulsion. These phases are controlled by signals sent through the brain and spinal cord. When a man has reached a peak sexual excitement level, signals are sent through the sympathetic nerve system. This triggers the first phase of emission. The sperm moves from the testicles up to the prostate. There, it mixes with fluid from the seminal vesicles to make semen. Then expulsion occurs when the pelvic muscles contract. This rhythmic contraction forces the semen out of the penis. For most men, the erection goes down after this step. For some men, erectile dysfunction is also a problem along with the premature ejaculation. When this is the case, it can sometimes be difficult to tell whether the issue is the erectile dysfunction or premature ejaculation. In these men, the erectile dysfunction should always be treated before the premature ejaculation. In many men, with the erectile dysfunction improved, the premature ejaculation will no longer be a problem. Let's talk about the causes of premature ejaculation. We certainly don't know a whole lot about premature ejaculation, but we do know that serotonin appears to play a significant role. Serotonin is a natural chemical created within the brain. High levels can prolong the time to ejaculation. Low levels can quicken ejaculation and lead to premature ejaculation. Certain mental health issues can contribute to or cause premature ejaculation. These include stress, guilt, depression, unrealistic expectations about sexual performance, poor self-confidence, relationship problems, and repressed sexual preference. The optimal treatment for premature ejaculation isn't clear, but many men will benefit from the multiple treatment options that are available. Therapy is a valuable treatment option for many men. It can help you deal with negative feelings and emotions. It can also provide you a way to feel more confident about your sexuality. Therapy can also be done as partner therapy. This can be especially helpful to allow the partner to express their concerns. Behavioral therapy can also be useful. Most behavioral therapies work best when your partner is on board. This is why partner communication is so important for the management of premature ejaculation. The behavioral therapy is typically the squeeze method. The squeeze method involves sexual stimulation, either with a partner or by yourself, until you feel near to climax, but still before the point of no return. Once there, you or your partner squeezes the penis, typically the head, until the erection partially goes down. This should suppress the ejaculatory sensation. This can be repeated as many times as necessary during intercourse. This technique helps you to better understand the sensations you experience prior to climax so you can better control them. The next method is the start-stop method. This method involves sexual stimulation with your partner until you feel near to climax, but again, before the point of no return. Your partner then stops, or you stop penetration, until the urge to climax goes away. Sexual activity is then resumed. This can be, again, repeated as many times as desired during the sexual encounter. Again, over time, this will help you to gain more control. There are also some medication options that may help. The most common of these medication options are numbing creams or sprays. Some of these come coated on the inside of a condom. In fact, for some men, simply wearing a condom to decrease some of the sexual sensation will help. Others are creams or sprays that can be purchased. These are typically applied 15 to 30 minutes prior to sexual activity and then washed off about 5 minutes prior to sex. Some newer options are wiped or sprayed on minutes before sexual contact and don't need to be washed off. Do be careful though and make sure you read the instructions carefully. If left on for too long, these may cause your erection to go down or can cause your partner to experience numbness if their body parts are exposed to the medication. There are also certain antidepressant medications that can prolong ejaculation. This goes back to when we talked about serotonin. These medications, called selective serotonin reuptake inhibitors, or SSRIs, increase serotonin levels in the brain and increase the time to ejaculation. If you try one of these medications and it doesn't help, your doctor will often try a different one. If two don't work, then it's unlikely a third would. These drugs can be taken either on a daily basis or an on-demand basis. That means you take it usually 2 to 6 hours prior to sexual activity instead of every day. I mentioned it before, but I want to emphasize it again. Talking about the problem with your partner is so important. Couples counseling or sex therapy can be very helpful. Most of these treatment options require your partner's help and understanding anyway. Good communication is the key to fixing this. Worry and stress only makes premature ejaculation worse. So to recap, premature ejaculation is ejaculation before you or your partner wants. It's quite common. There are therapies that can help, and there are medications that can help. I hope this information has helped you to better understand premature ejaculation. Please click the subscribe button to stay up to date on my health videos and leave any questions in the comments section below.